McMaster announcing this week that South Carolina will see new restrictions on SNAP benefits in the very near future. McMaster says he plans to issue an executive order directing the Department of Social Services to put common sense limits on what the more than 580,000 people in the program are buying in this state. Our Barlise Pimentel talked with public health officials and SNAP recipients about these potential changes. She's live in the studio now. What do folks think about all this?
Public health officials say this is going to impact hundreds of thousands of people. They say being limited to only healthier options is an advantage, but it's not just the limits on food to be worried about. They say SNAP benefits overall will not be easily attainable. People say their power to choose is being taken away.
Trying to dictate what you do with your benefits. When you telling people what you can and can't get, that takes away your freedom.
Tim Wise, a father grocery shopping with his son on Thursday, says he doesn't agree with restrictions on SNAP benefits. On Wednesday, Governor Henry McMaster announcing on social media that an executive order will be put in place for what he calls common sense limits on purchases. It means candy and soft drinks will not be available under SNAP benefits.
They're trying to make them eat healthy, but that's not what the kids want. It's about control, basically. The kids are not going to agree with it. The parents are not going to agree with it.
According to the Department of Agriculture, these 12 states have approved SNAP food restrictions. Public health consultant Dr. Bambi Gaddis says there are several other components that come along with this, and it's not just restricting food.
There are expanded work requirements that are potentially going to go into effect, which may be disconcerting or problematic for some people, especially people who are uninsured.
Gaddis says it all comes from the Big Beautiful Bill initiative from President Donald Trump and his plan for federal cuts. She says people who aren't insured, people who have issues obtaining employment, and undocumented people will be impacted the most.
People who traditionally have been able to access supports for food will automatically be eliminated. The last thing that we need in this state are people who are unfed, who are malnourished.
She says more people will go unfed and may still be a liability to the state because they won't be able to provide for themselves or their families. Gaddis says the SNAP benefit changes could also create a concern for college students when their on-campus cafeteria is closed.
Given that we're looking at the next generation of leaders, we should ensure that these SNAP cuts do not impact these able-bodied students who are still on parental support but do not have full access to food, fruits, vegetables, and things that will help them make it through.
Dr. Gaddis says these are some of the biggest questions people could face because nothing is official yet. We won't know everything until Governor McMaster outlines for DSS what the restrictions are going to be and the magnitude of them. Back to you, Brian.